As a diagnostic radiologist in community practice, I'm really excited about all of the opportunities artificial intelligence will bring to our practices as it evolves. Artificial intelligence is poised to impact our care at every phase of our imaging value chain. That is, from when imaging is first considered by our referring physicians all the way through the time that our referring physicians and patients fully understand the results of their examinations. For instance, artificial intelligence algorithms will help our referring physicians pick the correct test for the patient based on data mining in the medical record, not just to assure that the appropriate images are performed, but actually to find out when imaging examinations would be more appropriate based on information in the medical record, or even when they look at things like genomics or even data from smartphones that would suggest imaging tests. In the next step of the imaging value chain, that is when we are actually acquiring the imaging, AI is poised to help our technologists choose the correct protocol and even adjust the protocol during the examination based on things like patient motion. I'm particularly excited about how detection of critical diseases will impact the care. For instance, if our patient, Mrs. Jones, is in the emergency department and the ER team is worried about an acute stroke, they've ordered a CT scanner and she's over in our department, and while she's on the table, an algorithm is able to detect a brain hemorrhage or an acute stroke. Well, that means the technologist can notify us immediately about those critical results, and then Mrs. Jones can get more appropriate imaging while she's still there in the lab, such as CTA or perfusion, and all that can be done without having to send the patient back to the emergency department, and really improve our efficiency in this most critical time for patients suffering from acute strokes. In general reporting, we see artificial intelligence algorithms really giving us the ability to enhance the way we classify diseases, standardize our reporting, and really bring information into our imaging reports that we couldn't possibly do before these algorithms were developed. And then finally, on the communications end, artificial intelligence algorithms can continuously mine the patient's medical records to remind patients when follow-up examinations are due, and other things like critical results notifications for our referring physicians. Really, really great opportunities for AI to improve the care that we provide our patients. One of the most exciting possibilities for artificial intelligence is to actually find things in the images that we as radiologists aren't able to see. Because artificial intelligence algorithms don't really look at the image the same way we do in a visual basis, there may be lots of information that are embedded in the images that would actually bring to bear new information about the patient that we will be able to use in their care. For instance, deciding whether a brain tumor has a phenotype that is amenable to chemotherapy versus one that wouldn't respond to therapy.
Okay.
So we'll start over with the. So as a diagnostic radiologist in community. As a diagnostic radiologist in community practice, I'm really excited about all the opportunities artificial intelligence will bring to our practices as the use of artificial intelligence evolves in medical care. Artificial intelligence is poised to bring new information. Artificial intelligence is poised to impact the care we provide our patients at every phase of the imaging value chain. That is, from our referring physicians first consider imaging to when our patients and our referring physicians fully understand the results of their examinations. For instance, artificial intelligence will be able to data mine the patient's electronic health records to ensure that the most imaging examinations are ordered and performed. Artificial intelligence will even be able to look at other sources of information, such as patients' genomic information, information from their smartphones or other devices, to decide whether or not imaging might be beneficial for that patient. This may bring new patients in for imaging at a time when we can assess disease before the patients are even symptomatic. Next, in the imaging value chain, artificial intelligence will help our technologists choose the proper protocols for the examination. It will even be able to help them adjust the protocol during the examination to compensate for things like patient motion or other artifacts on our scans. One of the things that excites me the most is the ability for artificial intelligence to detect critical One of the things that excites me the most is artificial intelligence's ability to detect critical diseases just at the point of care. For instance, Mrs. Jones is over in our emergency department and the ER team is worried she has an acute stroke. They've ordered a CT scan and she's over in our department having that scan. An artificial intelligence algorithm detects that she's had an acute hemorrhage in the brain. At that time, the radiologist can be immediately notified, and while she's still in our department on our CT scanner, appropriate imaging such as CT angiography can be performed, drastically reducing the amount of time it takes for the diagnostic evaluation to occur. After imaging, artificial intelligence will help us with classifications of diseases, help us standardize our reporting for our referring physicians, and really make our reports more robust as far as the amount of information we can provide our referring physicians. Artificial intelligence will help us communicate much better with our referring physicians and our patients. Data mining algorithms can look at when patients are due for follow-up examinations and other issues in their care that will enhance the way we are able to communicate with our referring physicians and our patients. Artificial intelligence algorithms will actually empower our patients much more. Artificial intelligence is poised to empower our patients in their own care. Some people may think that artificial intelligence will only be applicable to large academic practices, but I don't think that that's going to be the case. While any new initiative in radiology begins at the academic practices, because artificial intelligence algorithms can be integrated quickly into our PACS systems, our electronic health records, and our reporting software, the ability to distribute artificial intelligence algorithms into community practices like mine will be heightened. For instance, for our practice, it's very difficult to do justifications about when we're going to get a 256 detector row CT scanner with a dual energy X-ray tube. However, upgrades to PACS, upgrades to our reporting software will include these algorithms. And so I see artificial intelligence becoming pervasive in community practice really sooner than later. It's easy to believe that artificial intelligence algorithms will only be applicable to large academic practices. However, that probably won't be the case. In fact, like any new initiative in radiology, certainly the algorithm development will occur at our academic institutions. But because the outputs of the algorithm will affect the tools that we're already using in practice every day, such as our electronic health records, our PACS, and our reporting software, the ability to distribute the algorithms to clinicians in community practices like mine will be much easier than the ability to get new modalities, new equipment upgrades and such into our practices. For instance, all we have to do to get algorithms into our practice Some of us may believe that artificial intelligence algorithms will only be for large academic practices. However, those of us in community practice need to be prepared to adopt them as well. Like many new initiatives in radiology, they will probably begin in our academic centers. Algorithm development will occur there. But the ability to distribute the algorithms to community practices will be so much easier than buying equipment upgrades that I believe that we'll see these algorithms in practice sooner than later. For instance, in my practice, it's hard to justify getting the latest and greatest CT scanner with 256 detectors and dual energy technology. However, it's much less difficult for us to get the next PACS upgrade, the next reporting software upgrade, and all of those upgrades will likely start including AI algorithms. And so those of us in community practice need to be ready to adopt this technology in our practices. About 5 years ago, the American College of Radiology developed an initiative called Imaging 3.0 to help radiologists go from volume-based care to value-based care. Artificial intelligence will be a natural extension of Imaging 3.0 in order to bring About 5 years ago, the American College of Radiology developed the Imaging 3.0 initiative, which was designed to help radiologists move from volume to value. So I don't like that. About 5 years ago, the American College of Radiology developed its Imaging 3.0 initiative to help radiologists transition from volume to value-based care. Artificial intelligence will be a natural extension of this Imaging 3.0 initiative because its informatic tools will provide radiologists even more opportunities to enhance the care that we provide our patients. There was a recent report from the Institute of Medicine, which is now called the National Academy of Sciences, that highlighted errors in diagnosis and preventing errors in diagnosis. The result of that report was that in order for physicians to reduce the amount of diagnostic error, there needs to be more coordination and more integration of information from all of the sources into the care that we provide our patients. Radiologists using artificial intelligence will be poised to be the purveyors of coordinating all of that information to impact the care we provide our patients. One of the major tenets of the ACR's Imaging 3.0 initiative is to encourage radiologists to provide care beyond the interpretation. As we look at the entire imaging experience for our patients, the interpretation is just one segment of what we do of the care that we provide. Artificial intelligence can impact the care that we provide in other ways that will help us add value beyond imaging interpretation. Artificial intelligence is poised to help our patients become more engaged in their own care and provide ways for radiologists to communicate both with our patients and their referring physicians, really creating a team-based environment for delivering care. 5 years ago, the American College of Radiology created the Imaging 3.0 initiative, which was designed to help radiologists transition from volume-based care to value-based care. Part of that value proposition is for radiologists to provide value beyond the image interpretation and extend that care into all phases of the patient's imaging experience, from when referring physicians order the examination all the way through the time that patients fully understand the results of their examinations. Artificial intelligence is a natural extension of the American College of Radiology's 3.0 initiative.
I would say you said 3.0 initiative.
What did I do?
You said the college's 3.0 initiative.
Oh, I did.
Yeah.
Okay.
We all know what that is.
Yeah. AI is a natural extension of the ACR's Imaging 3.0 initiative because it provides informatics tools that will help us provide better care for our patients at every phase of our imaging value chain. These informatics tools will help not just radiologists, but also our referring physicians and our technologists improve the care that all of us are providing our patients in a team-based way. In fact, we believe that with enhanced communication tools that will be part of artificial intelligence algorithms, patients will become even more empowered in the care that they're provided by the patient's care teams. So where are the patients in all of this? They do that without an So where are the patients in all of this? The ACR Imaging 3.0 initiative is designed to put the patient in the center of the care that we provide, and artificial intelligence algorithms will help us provide more patient-centered care than ever before. Artificial intelligence will help bring personalized medicine to fruition. That is, we'll be able to focus on every aspect of the patient history, Artificial intelligence will bring a more personalized experience for the patients. Because of the specific data mining tools that AI can use, our care can be focused and tailored to our individual patients while still providing all of the expert imaging care we provided in the past. Patients will have a more personalized experience, and their care will be tailored more to their needs. As a patient, we shouldn't fear that artificial intelligence will replace our physicians. We all know that our airplane pilots have an automatic pilot at their disposal, but I don't think any of us are ready to fly in an airplane that doesn't have a pilot. At the same time, those safety tools that the autopilot bring to the pilots really help them make sure that our flights are safe, on time, and efficient. And so none of us would want to fly in an airplane without an autopilot either. So this is the example of what artificial intelligence in medicine will do. Artificial intelligence will help our physicians provide their patients better care by bringing tools to bear that weren't available before.
Nice.
As a patient, we can rest assured that artificial intelligence will not replace our physicians. Just like all of us probably wouldn't want to fly in an airplane without a pilot, we also wouldn't want to fly in an airplane that didn't have an autopilot available to our pilots to help improve our flight and make it more safe and efficient. Artificial intelligence in medicine will do the same thing for our physicians. Our physicians will be able to use artificial intelligence algorithms to improve the care that we provide our patients without compromising the medical judgment that we are able to bring. Artificial intelligence algorithms will help us take better care of our patients without compromising the medical judgment that we provide.
Great. Period. Yep.
Let's look at the example of the potential for self-driving automobiles. We all know that developers have been working on teaching cars to drive themselves for any number of applications down the road. In order to accomplish that task, the developers had to teach the computers a myriad, perhaps thousands, of different individual tasks. They had to teach it what is a stop sign, what is a red light, what do the lines on the road mean. All of these individual tasks had to be collated and put together to drive the car. Now, if we apply that to medicine, look at it this way. All of us learn to drive a car in a fairly short period of time. Some of our family members or other person took us out in a parking lot and showed us the tools in the car, showed us the rules of the road. We practiced for several years, and when we were 15 or 16 years old, we were able to get a license to drive the car. Now compare that to what your physicians need to know. After college, your physicians have spent 4 years in medical school, 5 or 6 years in residency training, some in fellowship after that, with 30 years of clinical experience. So instead of teaching the computer 1,000 tasks, developers now will have to teach the computer tens of thousands of tasks, if not more, in order to be anywhere on par with the kind of care that your physician would provide. Now, case by case, use by use, artificial intelligence algorithms will help your physicians at every phase of the care we provide. But we don't look to see artificial intelligence replacing your physicians anytime soon. So we all know that there's a lot of hype out there about artificial intelligence and what the potential is and what really are some myths about artificial intelligence. So what can radiologists do to break through that hype and make sure that artificial intelligence is implemented in a way that's going to help us take better care of our patients? Well, first and foremost, we're going to have to embrace AI and recognize the value that it will be able to provide as we take. First and foremost, radiologists and other physicians need to embrace artificial intelligence and the opportunities it provides. Compared to companies like Google and Amazon and even other industries, medicine has been way behind in bringing informatics into healthcare. Artificial intelligence is the next thing that we can bring into our practices, into our tools that we use. And if physicians don't embrace it, the developers will go somewhere else and this technology will be lost on medicine.
All right, and good.
We shouldn't miss this opportunity or we will be behind again. Developers are looking for use cases for artificial intelligence that will have high value in healthcare. They are looking for data sets that can be annotated so they can train algorithms, and they're looking for opportunities to deploy these algorithms.
Sorry.
Developers are looking for high value, credible use cases for implementing algorithms in medicine. They're looking for annotated data sets to test and train these algorithms. They're looking for processes that will validate these algorithms. And they're looking for tools that can implement the algorithms into clinical practice. Physicians and radiologists in particular need to provide that help to developers so that we can move this technology into medicine. AI developers are looking for credible and high-value clinical use cases for artificial intelligence for healthcare. They are looking for data sets that can be annotated so they can test and train these algorithms and processes that can validate these algorithms that will ensure they are implemented in a way that provides safety for our patients. They will be looking to radiologists to help them develop these tools, and we shouldn't miss the opportunity to be involved or we'll be behind again. Effective implementation of artificial intelligence in healthcare will depend on collaborations between physicians, AI developers, and the healthcare IT industry.
And whenever you are ready.
Practicing radiologists should stay abreast of this rapidly evolving field and look for opportunities to integrate artificial intelligence in their daily practice through upgrades to their electronic health records, their reporting software, and their modalities, so that we'll be ready to take better care of our patients when the opportunities present themselves. Practicing radiologists should stay abreast of this rapidly evolving field in medicine and look for opportunities to integrate artificial intelligence algorithms in their daily clinical routines. These opportunities will probably present themselves in upgrades to the electronic health records, upgrades to our PACS systems, upgrades to our reporting software, and let us bring the tools that are being developed for artificial intelligence into our daily clinical routines. The American College of Radiology is committed to helping spread the message of artificial intelligence to radiology professionals in diagnostic radiology, interventional radiology, radiation oncology, and medical physics. The American College of Radiology is committed to keeping its members abreast of the rapid changes that are evolving in artificial intelligence. The ACR Data Science Institute will facilitate the implementation of artificial intelligence in medical imaging and the radiological sciences. An important role for the DSI will be to educate radiology professionals about advances in artificial intelligence in medical imaging and the radiological sciences, and to provide up-to-date information about the availability of artificial intelligence tools that we can use in our practices as they evolve. Probably need to do that again.
Yeah, I think so.
An important role for the DSI will be to educate radiology professionals about An important role for the DSI will be to educate radiology professionals about artificial intelligence in medical imaging, and to keep an important role for the ACR Data Science Institute will be to educate radiology professionals about artificial intelligence in medical imaging, and to provide information of the tools that are available to our practices to implement. I don't know why I can't do this. Just like
Is it ready?
an important function of the DSI will be to educate radiology professionals about the role of artificial intelligence in medical imaging, and to keep members abreast about the opportunities to integrate artificial intelligence algorithms into clinical practice.
Nice.
In order to facilitate the implementation of artificial intelligence in clinical practice, the ACR Data Science Institute leverages the expertise of diagnostic and interventional radiologists, radiation oncologists, and medical physics to develop use cases that are designed to help us take better care of our patients. These use cases tell AI developers exactly how the artificial intelligence algorithm will interact with the physicians or other humans, and also the electronic resources that will be necessary, and then to provide an output in a way that it can be integrated into our clinical practices. The ACR Data Science Institute will have expert use case panels that will use both clinical and data science expertise in order to develop details around these use cases that will allow developers to test and train algorithms, validate their algorithms, and define specific pathways of how the algorithm will be integrated into our clinical practices. These use cases will ensure the safety of our patients because they will also include data elements that would allow the algorithms to be validated with data sets not used in training of the algorithms to facilitate FDA approval and other processes in the regulatory space that will go into delivering these algorithms to clinical practices. Finally, the Institute will have use cases. Finally, the use cases produced by the Data Science Institute will also have data elements that will allow monitoring and surveillance of the efficacy of the algorithms in clinical practice. This information can be reported back to developers and even the FDA to improve the algorithms and ensure patient safety. The ACR Data Science Institute is facilitating the implementation of artificial intelligence into clinical practice by leveraging the expertise of diagnostic and interventional radiologists, radiation oncologists, and medical physics in the creation of clinically relevant use cases for artificial intelligence developers. ACR Data Science Institute use cases will be created by a panel of expert physicians with both clinical ACR DSI use cases are being created by panels of physicians with both clinical expertise and also data science expertise in order to develop use cases that will help us provide better care for our patients. These use cases in radiology describe how the algorithm will interact with both the human ACR data science use cases, describe the interactions between the humans, our electronic resources, both on the intake of information into the algorithm, and then the output of information from the algorithm will then be provided in a way that it can integrate with the resources that we use in everyday clinical practice, such as our electronic health records, our PACS, and our reporting software. These ACR use cases will also contain data elements that will allow developers to test and train algorithms and have data elements for exactly how they will interact with our reporting tools and other electronic resources. In order to provide more patient safety, ACR DSI use cases have data elements that allow vendors to validate their algorithms prior to FDA approval, and also data elements that allow monitoring of the algorithms after clinical deployment. The ACR Data Science Institute is establishing collaborations with industry by providing these clinically relevant use cases to developers, and also collaborations with government regulators such as the FDA to make sure that the approval process is both efficient and safeguards our patients. The ACR DSI is also considering the legal and ethical issues surrounding the implementation of artificial intelligence in medicine. First and foremost among these is safeguarding the privacy of our patients. We have to assure that as artificial intelligence algorithms are trained by developers, that patient information is protected. The DSI will look at all of these issues to ensure that this happens in a way that allows AI to advance without compromising the safety and privacy of our patients. There are many implications for artificial intelligence in population health management. Artificial intelligence will certainly help radiologists and other physicians standardize the care that we provide. Artificial intelligence is poised to help physicians in population health management. Artificial intelligence tools will help us standardize the care that we provide so that each patient is treated the same way in different parts of the country and in different institutions. Artificial intelligence will also play a role in helping us identify patients that can be examined with imaging before they become symptomatic. We all know that once patients become symptomatic from diseases, the opportunity for treatment is decreased. Many times in cancer patients, but by the time the tumor has actually caused symptoms, the disease is far too gone.
Let's start over.
In medicine, it's always important to detect disease as soon as possible. Many times we have to wait for patients to be symptomatic before we can detect the disease. However, oftentimes, after symptoms develop, diseases such as cancer have already spread and are unlikely to respond to therapy. We need solutions that help us identify patients at risk for disease before they become symptomatic, because then we're able to have therapies that will impact care and improve survival. artificial intelligence will be able to help us use data mining to identify these patients so we can bring treatment to bear on these patients even before they become symptomatic.
Whenever we're ready.
I'm Dr. Bibb Allen. I'm the Chief Medical Officer of the ACR's Data Science Institute. In addition, I'm a practicing radiologist in a community hospital in Birmingham, Alabama. Our group has about 35 radiologists, and it didn't quite work out like I was going to say.
Community setting. You don't.
Yeah, all right.
It's the imagination.
Right.
How big?
Right. I'm Dr. Bibb Allen. I'm the Chief Medical Officer of the ACR Data Science Institute and also a practicing radiologist in a community hospital in Birmingham, Alabama. Artificial intelligence in medicine has the opportunity to change the way we practice. In my career, I've had the opportunity to see the evolution of computer tomography, MRI, PET, and how those things changed our practices, all for the good of our patients. I believe artificial intelligence in medicine has an equal opportunity to be one of the most important tools we have to better the care we provide our patients.
I like all of that. Done all this very complicated stuff in there.
I'm Dr. Bibb Allen. I'm the Chief Medical Officer for the ACR Data Science Institute and a general radiologist in a community hospital in Birmingham, Alabama. I believe artificial intelligence in medical imaging is poised to revolutionize the way we take care of our patients.
Okay.
So let's do it whenever you're ready.
I'm Dr. Bibb Allen. I'm the Chief Medical Officer of the ACR's Data Science Institute and a diagnostic radiologist in a community practice in Birmingham, Alabama. I am excited about all of the opportunities that I believe AI will provide to revolutionize the care we provide our patients. The ACR Data Science Institute is here to facilitate that process. And before we talk about, the DSI is here to facilitate that process. But before we talk about the DSI, let's talk about artificial intelligence.
The only thing I would change.
But before we talk about the Data Science Institute, let's talk about artificial intelligence in medicine. The ACR Data Science Institute is here to facilitate that process. But before we talk about the Data Science Institute, let's talk about artificial intelligence in medicine.
Whenever you're ready.
Reimbursement for artificial intelligence in medicine will likely be a complex issue. In our fee-for-service environment, we might expect that there would be add-on fees for the use of artificial intelligence in the way we care for our patients. On the other hand, if artificial intelligence dramatically decreases the
Just start on the other
Yeah.
hand.
On the other hand, if artificial intelligence dramatically increases the efficiency of physicians, then it may change the way the physician work is calculated. In alternate payment models or in ACOs where a lump sum is given to an institution to care for patients, the efficiencies that artificial intelligence provide may more than pay for the way the algorithms are implemented to help us take care of our patients. Finally, and perhaps most importantly, artificial intelligence may likely change the way radiologists work. Instead of our entire focus being on imaging interpretation, artificial intelligence may provide us a pathway to provide better care beyond the interpretation as we integrate the growing volume of information about our patients. This growth in information has been exponential, and artificial intelligence will help us use that information to take better care of our patients.